Dear ladies and gentlemen, thank you for giving me the opportunity to talk about our multicenter study for desmoid tumors treated by MR-guided high-intensity focus ultrasound. Here are my disclosures. Desmoid tumors are per definition benign and rare musculoskeletal tumors who can grow very aggressively and infiltrative. Depending on the behavior of each desmoid for each patient, there is a different set of treatment options. Each treatment option has a different set of efficacy versus side effects. Additionally, the stabilization rate of desmoids are around 30 months. So the tumor of each patient has to be individually evaluated if it can be managed by observation alone or if it needs treatment, some of which also have a very high morbidity for the patient. Recently, ablation has been included into the guidelines, which has a pretty high efficacy but not as much side effects as some of the other treatment options. We looked at safety and efficacy for the therapy of desmoids with MR-guided HIFU. It was a retrospective study with 3 sites who shared their experiences with each other from 10 years. 105 patients were included with 111 desmoids and 162 treatments were performed. For efficacy, we looked at treatments before and after HIFU, we looked at tumor volumes, we looked at response defined by RECIST or MRECIST, we looked at pain and we looked at quality of life. For safety, we graded the complications according to the Society of Interventional Radiology. The tumor volume at the treatment day was 114 cc's. Out of these 114 cc's, around 85 cc's was actually targeted. As you can see in this example, the reason why not everything was targeted is because the proximity to critical structures like to skin or to nerves is often preventing full treatment. Out of these 85 cc's which was targeted, around 83% was actually ablated, which represent 57% of the tumor. At 15 months, which was the latest follow-up per patient, the total tumor went down to 51 cc's and the viable tumor to 28.5 cc's. On the top row, you see total tumor measured by RECIST, and on the inferior row, you see viable tumor measured by MRECIST. On the left column, you see the best response, which is 16 months for the total tumor and 11 months for the viable tumor. On the right column, you see the latest response, which is around 18 months for both. As you can see, for the best response, most desmoids were at least stable or better for both viable and total tumor. This was also true for the latest response for the total tumor. However, we saw regrowth of 50% of the viable tumor at the latest response, which typically represented regrowth of non-targeted tumor which grew into the ablation cavity.
Pain, which is the most common symptom of the patient, goes down from 6 to 3 at 6 months, and quality of life goes up for both physical health and mental health. The complication rate is 37%. Most, around 80%, is mild and moderate, whereas only 20% is severe. The most common complication is a skin burn, and skin burns has been reduced by passive skin cooling of 46%. And recently an active skin cooling system has been introduced. This was not available for our cohort, and this will potentially decrease the side effects much more for patients treated with MR-guided HIFU. In conclusion, MR-guided HIFU seems to be an effective treatment option. It is especially to note that it is a non-invasive, non-toxic therapy, and by repeated therapy, the regrowing viable tumor can be effectively retreated. And in our cohort, most patients were not treated multiple times in order to shrink the overall tumor down because of insufficient insurance coverage. With repeated therapy of regrowing viable non-targeted tumor, MR-guided HIFU is a very promising technique.